Regional gross anatomy. Pectoral region. By Vijitral Khan, Ph.D. Associate Professor. Department of Anatomy. Pectoral region 1. Bony landmark, sternum, jugular notch, body of T2. Sternal angle of Louise, T4-5. Xiphosternal joint, D9. Ribs and costal cartilage. Scapula, acromion. Coracoid process. Clavicle. Supraclavicular fossa. Infraclavicular fossa. Humerus. Head. 2. Superficial structure. Skin and derivative of skin, breast. Breast, nipple, areola, mammary gland, F. 1. Surface anatomy, position. Nipple, 4 to 5 from the midline, intercostal space 4. Breast, between rib 2 to 7. 2. Components. Subcutaneous fat, mammary gland. Luctiferous duct. Cooper's ligament, suspensory ligament. Retinaculum cutis fascia. The majority of the breast is in the superficial fascia, except the tail part, tail of Spence, extends upward laterally into deep fascia at the lower border of Pectoralis Major. 2/3 of the gland lies on Pectoralis Major. 1/3 of the gland lies on serratus anterior. Deltopectoral triangle. Deep fascia separating deltoid and pectoralis muscles. Platysma equals superficial muscle, thin plate, extends from the mandible to the clavicle. 3. Muscles of pectoral region. A. Pectoralis major. B. Pectoralis minor. C. Serratus anterior. D. Subclavius. A. Pectoralis major. O. Middle half clavicle, sternum, rib 1 to 5. I. Lateral lip of bicipital groove of humerus. A. Adduction, medial rotation of arm. B. Pectoralis minor. O. Rib 3 to 5. I. Coracoid process of scapula. A. Draw the scapula down, lift up the ribs. C. Serratus anterior. O. Halfway of the anterior part of rib 1 to 8. I. Medial border, anterior surface, of the scapula. A. Pull scapula to chest wall, lift up the ribs. D. Subclavius. O. First costal cartilage. I. Inferior surface of clavicle. A. Protecting structures underneath the clavicle, pectoral girdle, clavicle, scapula, ribs. Clavipectoral fascia, costocoracoid membrane. Deep fascia separating the pectoralis and the subclavius. Blood supply to the pectoral region. 1. Axillary artery. 2. Perforating branches of the internal thoracic A. 1. Axillary artery. Divided into 3 parts. First part. Supreme thoracic A. Second part. 1. Thoracoacromial trunk. Acromial branch. Pectoral branch. Clavicular branch. Deltoid branch. 2. Lateral thoracic A. Third part. Give branches to supply head of humerus and scapular regions. 1. Deep veins, axillary V. Less than equals from the muscles. Venous drainage at the pectoral region. 1. Deep veins, axillary V. Less than equals from the muscles. 2. Superficial veins. Cephalic V. From upper limb, at the deltopectoral triangle, it pierces the clavipectoral fascia, or infraclavicular fossa, into the axillary V. From mammary gland, it drains into deep veins equals greater than internal thoracic V, and lateral thoracic V. 1. Superficial 2. Deep lymphatic drainage of the breast. Around the mammary gland, lymphatic network is highly anastomosed, drainage is parallel the venous drainage. 2. Deep lymph nodes are formed along the lymphatic vessels. A. From lateral side of the breast, drains into the anterior group of the axillary lymph node, the pectoral node. B. From medial side of the breast, drains into the parasternal node, the internal thoracic node. Nerve supply of the pectoral region. 1. Medial and lateral pectoral nerve, terminal branches from the cords of the brachial plexus, C5-8 and T1. Nerve to subclavius, a branch from upper trunk of the brachial plexus. Long thoracic nerve, nerve roots from C5-6-7 of the brachial plexus. Brachial plexus, C5-8 and T1. 2. Spinal N. Sensory, cutaneous, N. Supraclavicular nerve, C3-4, medial, intermediate and lateral branches. Intercostal nerve T3-7, anterior and lateral cutaneous branches. Dermatomy at the pectoral region, C3-4, T3-7. Clinical relevance. 1. Chest wall, heart/lung sound. 2. Clavipectoral fascia. Protection of the vessels and nerves underneath. Limit spreading of the abscess from upper limb to the neck. 3. Fracture of clavicle. Common site is at 1/3 from the lateral. 4. Breast cancer. Structural abnormality. Lymphatic drainage and metastasis. Mastectomy. Accessory nipples may appear on the milk line. Regional gross anatomy. Axilla. By Vijitrilode Khan, Ph.D. Associate Professor. Department of Anatomy. Axilla, armpit, pyramid, walls, folds. Anterior, Pectoralis Major and Min, subclavius, clavipectoral fascia. Posterior, latissimus dorsi, tes major, subscapularis. Lateral, humerous, tendon of long head of biceps brachii, tendon of coracobrachialis. Medial, rib 1 to 3 and intercostal muscles, serratus anterior, superior part. Muscles of scapular region. Muscles of scapular region. 1. Deltoideus. O. Lateral 1/3 of clavicle, acromion, spine of scapula. I. Deltoid tuberosity of humerus. A. Abduct arm to 90°, medial and lateral rotate arm. N. Axillary N. 2. Subscapularis. O. Subscapular fossa. I. Lesser tubercle of humerus. A. Medially rotate arm. N. Upper and lower subscapular nerves, C5,6. 3. Tes major. O. Inferior 1/3 lateral border of scapula. I. Medial lip of bicipital groove. A. Adduction and medial rotation of arm. N. Lower subscapular nerve, branch of posterior cord. 4. Supraspinatus. O. Supraspinus fossa. I. Superior facet of greater tubercle of humerus. A. Abduction of arm. N. Suprascapular nerve. 5. Infraspinatus. O. Infraspinous fossa. I. Middle facet of greater tubercle of humerus. A. Abduct and lateral rotate arm. 3. Tes minor. O. Superior 2/3 lateral border, dorsal surface of scapula. I. Inferior facet of greater tubercle of humerus. A. Lateral rotation of arm. N. Axillary nerve. Quadrangular space. Triangular space. 1. Axillary A. And branches 2. Axillary V. And tributaries. Contents of the axilla. 1. Axillary A. And branches 2. Axillary V. And tributaries. 3. Brachial plexus. Axillary sheath, deep fascia that wrap around the axillary vessels and the brachial plexus. Formed by part of cervical fascia. 1. Axillary A. And branches 3rd part. Anterior humeral circumflex A. Posterior humeral circumflex A. Subscapularis A. 2. Axillary V. And tributaries. Superficial branch, cephalic V. Deep branch, venicomitant of brachial V. In the axilla vein lies medial to the artery. It is the most expandable structure in the axillary sheath, enlarged when the blood flow is high. 3. Brachial plexus. Formed by anterior primary rami of spinal nerves level C5, 8 and T1, formed into trunk, division, cord and branches. Upper trunk equals C5 plus C6. Middle trunk equals C7. Lower trunk equals C8 plus T1. Most of the brachial plexus in the axilla are cords and branches. 1. Lateral cord and branches. Musculocutaneous N. Lateral head of median N. Lateral pectoral N. 2. Medial cord and branches. Medial head of median N. Ulnar N. Medial pectoral N. Medial cutaneous nerve of arm. Medial cutaneous nerve of forearm. 3. Posterior cord and branches. Axillary N. Radial N. Thoracodorsal N. Upper subscapular N. Lower subscapular N. Axillary lymph nodes. Receive vessels drainage from the upper limb, lateral part of the breast, superficial of thorax and abdomen, above the umbilicus, and the back. Axillary lymph nodes. Divided into 6 groups. 1. Anterior group. 2. Posterior group. 3. Lateral group. 4. Central group. 5. Apical group. 6. Subclavian lymph trunk, node and vessel locations. 1. Anterior group. At the lower border of pectoralis minor. Drainage parallel the lateral thoracic V. 2. Posterior group. Anterior to subscapularis M. Drainage parallel the subscapular V. 3. Lateral group. At the lower border of tes major. Drainage parallel medial side of axillary V. 4. Central group. The outer border of first rib. 5. Apical group. At the apex of the axilla. 6. Subclavian lymph trunk,